Right, hi, I'm Tony, and I'm the guy in the top right there, and that's my shed. Oh, and this is what's in my shed. And so this is really about silver diamine fluoride and how it can help us and help the general public. And I have this Reaver Star, as you can see there, but unfortunately I retired before I had time to use it. But these are some of my interests, and this is what it's about. So I'm going to use the videos from Jeanette, and I contacted her about 4 years ago. And if you want to know more about silver diamine fluoride, Wikipedia is a great resource. It's what doctors use. 70% of young doctors go straight to Wikipedia. So it's probably not exact, but it's probably better than anything you'll get from me. That's not true. Anyway, please go onto Teeth for Life Shorts. And I've made a website, Dental Health Service, and this is just part of it.
AI is here to stay, and in dentistry it holds incredible potential. While we wait for leadership from our governing bodies, why not take the initiative ourselves?
We can improve oral health and overall well-being. Teledentistry is a cheaper, greener dental therapy at home. Embrace teledentistry, and you may not hear this noise again.
Visit our dental health service website to explore how we can work together.
Yeah, that was big. Didn't expect that. But basically, this is the website that I've built so far, and I want to make a dental app. And if you want to know more about how this should work, go onto the website. And this won't be exactly as it says there on how we should learn, but I certainly need your help for teledentistry. But this is about silver diamine fluoride. You can see to find out how, I'd say learn. They're about 20 minutes, a 20-minute course, I think, which all good courses should be. And this might be a bit longer. I hope not. But yeah, so I made a website during COVID, and if you type in silver diamine fluoride on the teethforlife.org.uk website, you'll find out a bit more about it. And the person that helped me, I never knew about silver diamine fluoride until around this time, and I heard from Kirk. So if you go into here, press that, and then a lot of the references I'm talking about are on the website. And so you will always find, whenever I listen to different people talking about certain things, such as Clayton Christensen talking about health innovation, this is a very similar slide saying the same thing. And so there's going to be some repetition, but some of these videos I'm going to run through now, and they're the best videos because they're only about 2 minutes long, although there will be a run of them. And I went to the States on this course this year and gave a little talk. But the person I wanted to see is one you'll see in a moment, and also the person at the bottom here, Paul Glasson, and he gives a brilliant talk on how we can save children going into the care home, going to have teeth extracted in hospitals. We just need to expand those who can deliver this silver diamine fluoride. So as I say, I think this is a slide from, or a picture, screenshot from my website. But this is from an email that I sent to her, and the reply I got and this is August 2020. So around that time we had COVID, and I had ended up working for a dental corporate in what is my premises. And clearly our values weren't aligned, and I wasn't enjoying work at all. I didn't think we were providing an ethical service. So I left, and I've retired, as you can see. So this is, the first thing is what, silver diamine fluoride, what's it treat for? Well, it's treating disease as opposed to kind of removing the disease, which is what we're used to. So if you think about it, then what we do is remove diseased tissue, and so if you broke your leg, you probably just have your leg taken off, It's not as bad as that. But anyway, these are just slides that they're all taken from the teethforlife.org website. They're all on that. And so one of these is the camera. So I had a camera, and I went on the courses on taking photos. And I never expected anyone to see any of my photos or anyone see my radiographs. And this is a couple of devices that I used. The one on the top left I never used really, because it was for using people's phones to take pictures of their mouths, which I thought would be useful for teledentistry. And so these are some pictures that I took, and I used to do presentations to a peer review group. We all used to take it in turns doing talk. And as you can see there's a blob of glass ionomer, Well, that blob of glossionomer put in probably what was a tricky child worked. The child never had the tooth out. They never had dental pain. It looks grim. I think it's the only one I've got. But it works well. And you can see there's a sealant. There's all kinds of stuff we can do with photos. Well, my first camera cost about £6,000. But this one is a picture I took at home from a home camera that cost me £50. So there's no reason people can't have cameras at home. And this was like 4 years ago. So with technology now, we'll get all kinds of things where we can take pictures of our mouths. And radiographs, so yeah, they're great for, they're not so good for occlusal caries, but they're good for interproximal caries. But these are also a little bit small, and these are ones that clearly I did back in '88. And this is, and there's a picture of one in your hand, and what would you prefer? And the other one's got a far lower dose. And I think it's the same patient. And you can see this dentist, this huge area, it's not great. But that person never had the teeth out. That's a different talk. And this is me, and this is 2012. So we went digital very early. So you can see in the back we've got, I think it's a DER scanner. And that's on the left, and that's to scan the radiographs. And so, we were obviously early adopters. And on the right is the CEREC scanner that I bought. It was a blue cam. Now, these scanners are fantastic. I had to dry the tooth, spray powder. It was a nightmare, but even if I say so myself, I got great results. And it's minimal invasive dentistry, which is what I wanted to continue to do before I gave up work. So the other part about diagnosing teeth, I used a Diagnodent, and I had an ozone machine, which not many people have, but I really like my ozone machine. The research on it was rubbish, but the research, the way it was set up, that was rubbish too. It was never going to give anything half decent. But in the corner there, you can see the Diagnodent. Now, this was fantastic with kids, because what you do is you just put it over the tooth, and if it made a noise and it got higher and higher, you knew it was decay. And so I used this in an interesting way. But the other part was that this one was far better. They brought one out later that was Wi-Fi, and it didn't work so well because all our mobile phones interfered with it. So the original is still the best, and really they should be a lot cheaper than they are, and you should be able to take them around schools and care homes. And yeah, the next one I said was about scanning. I forgot to put in a slide about scanning, but if you go on to any YouTube and ask scanning for caries, the one I've been looking at a lot is called the Medit. And look at Medit. It's still in the beta phase. It's been in the beta phase for a year, but these things are going to come in. And yeah, I was going to put another slide on here about from Rory Sutherland, who basically talks about alchemy, and we need to market things different. So people, obviously this is a very elderly person, but caries, the tooth going black, I think is quite a good thing for children, especially. And I don't think the aged population mind. They'd rather have that than have the tooth out. So anyway, this is the person, Janet McLean, and the one I asked permission to put the videos on. So there's going to be a series of videos now that I hope you hear, and they're all about 2-3 minutes long, and they're self-explanatory. And as you can see, she entertains the troops. She talks to children in the right manner, and as well as the application, it's the mannerisms and how everything moves. That's what you want to observe, and so there will be some repetition. One of the good things about IT is when you make a mistake, you can kind of go back. And I had a reply from Jeanette McLean saying the sound wasn't great, and she was right. So I've redone it. And these are the timestamps in between. So as you can see, there's about 26 minutes of just her videos that she's made, and they're ideal, I think, for anyone trying to use SDF. And also, at the same time, I've also got some videos back from Sarah. So it's now about an hour long, this. But it's brilliant advice, and it's on a video. And the best thing is it's far better than a book. Just watch their hands, see how they talk to the patients, see how everyone's involved. Half of it is just keeping children on side, and the same applies to the elderly. So I hope you like this, and just adjust the times accordingly.
Hi, Dr. McLean here. I'm going to show you how to apply silver diamine fluoride, or SDF, without the need of any compressed air or water syringe. So we're going to be able to do this without creating any aerosol. And our patient today is actually a repeat patient. It's my daughter Sabrina. She's had silver diamine fluoride applied before. All right, you ready to start? Okay, so the first thing, I like to put some Vaseline on their lips and face, just so I don't get the SDF on them, because it can leave a little temporary tattoo, kind of like a henna tattoo that will disappear within a couple of days, all on its own, just depending how quickly their cells turn over, the skin cells. You can also get it off with hydrogen peroxide. Now we're going to isolate the tooth. Can you open big? Ah! I like to use dry aids and cotton rolls. And you can see, open really big. See that little spot on the occlusal? Lift your chin up. On the occlusal of her primary second molar, you can see that little groove where she's had SDF treatment a number of times. Okay, so we're going to now dry it off. We're not using compressed air, so you can use cotton to dry it. Okay, cotton roll. You could use gauze. Keep your little tongue, silly tongue, out of the way. Okay, so you want it nice and dry. All right, open really big. Okay, so nice and dry. And now we're going to apply it with a micro brush for 1 minute. Try not to allow it to get on their tongue. The flavor is rather unpleasant. Okay, and now we're going to allow it to absorb for 1 minute. Okay. Okay, just a few more seconds left. So there's nothing else you need to do. If there is some excess pooling on the top, you could blot the excess with some cotton. Can you open really big so I can get the extra off? Thank you. So you can just blot excess, and that's all you have to do. Now this is optional. It's not necessary for efficacy. It's just my personal preference. I do like to cover with a varnish. So this is Floramax Mint. We like to call it candy cane. All right. All right, so now you're going to carefully remove your dry aid. And then this is a little trick I like to do, is I like to put the cotton roll over the tooth and then have them bite down on it. Cheese! Because that also helps them not have a strong reaction to the flavor. Was that easy? Mm-hmm. Yay, high five. All done. All right, we're going to show you our basic setup for applying silver diamine fluoride. For starters, you want to make sure you protect the surface that you're going to be working on. So I like to use a patient napkin, which is plastic lined. You want to protect yourself, of course, so make sure you're wearing gloves whenever you handle any of the materials. And then you want to protect your patient, so a plastic lined patient bib and some sunglasses. And then I like to put copious amounts of Vaseline over their lips and skin to prevent a little temporary tattoo. All right, so now we're gonna isolate the area. You want it to be toothbrush clean. And I like to use a bite block if I can. And then we're gonna isolate the area with a variety of cotton products, whether, you know, depending what area we're working on. I could use gauze, cotton roll, little paper dry aids, or there's absorbent dry aids in a variety of sizes that you could use. Those are great. If I'm gonna be doing the inner proximal technique, I'm gonna actually use some super floss. All right, so once everything's dried and isolated, you're ready to go. So you're gonna put 1 drop of the SDF into a plastic Dappen dish. This is very important. You don't wanna use a glass Dappen dish because the SDF will actually react with the glass, so use a plastic Dappen dish. Make sure you're careful when you're holding or handling the bottle. I don't know if you can see, there's a little drop of black on here. It migrates, so make sure you're wearing gloves. You never wanna set it down on a bare countertop. You'll notice over time you'll get a little ring around the bottom of the bottle. You'll even see it inside the box. So just make sure you're careful because you don't want to stain your countertops. I apply it with a little fuzzy micro brush, and just a regular micro brush is all I use. Probably has to do with the fact that I do a lot of interproximal lesions with the super floss, and I find that other brushes were snagging the floss, so just a fuzzy micro brush is great. And then we're gonna leave it on there for 1 minute. So I like to have a little handy kitchen timer set for 1 minute because that can feel like a long time. So it's good to have a point of reference. And then once it's done, I like to cover the area with varnish. So for a couple of reasons. One, to cover it and prevent saliva from washing in the area, and that will give more time for the silver diamine fluoride to absorb deeper into the enamel and the dentin. And another benefit is the taste, because the varnish tastes better. I like this 2.5% varnish from Elevate Oral Care. It's nice because it comes in a bottle, so you can put 1 drop of that next to your 1 drop of SDF. So it reduces waste and cost associated with, say, if I were to open an entire unit dose of varnish, I'd be throwing a lot of that away. So this is more convenient and cost effective. And then of course you need your little brush for the varnish. And then if you want to be really nice, because the SDF can have a little bit of a metallic taste, even sometimes when you're applying the varnish, we can give them a little xylitol lollipop. And then we also keep everything in a little tray, and this is just plastic tray we probably got from Walmart or the dollar store, but you keep all your supplies in here. Makes it nice and convenient, so you can make one of your own depending on how many operatories you have. It's nice because you can carry this from room to room. And that's pretty much it. All right, today we're gonna apply silver diamine fluoride to my little friend here. So we're gonna first wanna make sure that we have informed consent from the parent and make sure that they understand the potential staining of the decay on the teeth and possible accidental staining of their skin or clothing. And then once we have their permission or consent to proceed, we wanna protect them with glasses and a little plastic lined bib. We're gonna put some Vaseline on the lips. So this is going to help prevent any accidental staining on their skin. Good job. Okay, and then we're going to have you open nice and big. Can you open nice and, whoa, thank you. So our friend here had SDF applied before, so you can see some of the little spots in there. Yeah. Do you remember when we painted your teeth before?
Ow.
We're going to do that again. Is my finger too chubby? Is that the ow? Okay. So the teeth need to be free of any debris or food or plaque. He's already had his cleaning, so we're good with that. You don't have to do any sort of tooth preparation. You don't have to remove any dentin or anything. You just free from plaque and debris. And then we want to carefully isolate and dry the teeth. So I'm going to put a little triangle. That's a triangle to help keep your tooth dry. And I'm going to use a little cotton roll by your tongue. Good job. That's going to help keep your tongue out of the way. Ta-da! So there's your teeth. And then we're going to blow a little air to dry the teeth off. Awesome. Okay. And then we're going to carefully apply the SDF with a fuzzy micro brush for 1 minute, and we're going to be careful to not get it on any soft tissue. There you go. So we're painting it on. We're going to start a little timer. Good job. Can I have some more, please? There you go. You're doing awesome, buddy. So if you can, try to apply it for at least a minute. And then you're going to blot the excess with, you could use a cotton roll or gauze. But if you can allow it to soak for up to 3 minutes, that's really ideal. And you're doing amazing.
What?
I said you're doing amazing.
Oh.
Yeah, you're helping all the other kids see how to do this. Okay, so it's been 3 minutes. So now I'm gonna dab up any excess. Okay. And I'm gonna carefully take out our triangle and our cotton roll. Can you open a little bigger, sweetie? Ta-da. And then you're done. Was that easy?
Mm-hmm.
Yay. Awesome. Thank you. Doing good, honey. Is that silly? All right, baby.
Yeah.
Can you open really big for me, honey? I'm gonna put a cheek diaper. Good girl. And I'm gonna put a cotton roll. And then I'm gonna dry your tooth with some air. Here's some air, baby. Okay, stay open nice and big. Here comes my paintbrush. You're doing so good.
What? What?
Yep, special vitamins.
What? Coffee?
Okay, try not to talk because I have to paint. I don't want to give you a mustache. Good job. Okay.
What?
All right, stay open. We're going to wait 1 minute and put some more vitamins on your teeth. You can pass me the varnish. Almost done. Okay, let me put them on your other teeth. Bubble gum. Bubble gum. Yeah. Almost done. Stay open. 30 seconds. You can do it. It's your favorite song. Here, look straight up. Look up at Dada. Good girl. You have the eye of the tiger, don't you, Sabrina? Yeah. Almost done. 8. Oh, are you petting me? 6, 5, 4, 3, 2, 1. Woo. Good girl. Can you grab the suction for me, please? You did it! Good girl. Can you spit in a little straw? All done.
Give us a little kiss.
Is that easy? Thank you. Ooh, sounds good. What Barbie is it?
She wants a Barbie that you can style her hair.
Oh,
Nice.
I like it. Okay, let's get Vaseline on you. We're gonna put our little pillow back in there. Is it the head with the hair and you can do the makeup? Oh yeah, my daughter would love that too. Ooh, you are good. Put our little pillow in there.
Okay, I know it's a lot of
Okay,
stuff, but you're all
you
right.
can do it. We're gonna put our little cotton on your cheek, and then I'm gonna dry your tooth with my air. Can you lift your chin up a little bit, sweetie? Thank you. I'm gonna dry in between your teeth. Perfect. And then I'm gonna put our little fuzzy floss in there, our super floss.
Job, Emma.
I'm gonna floss it in. You're doing great. Just keep breathing through your mouth. You can breathe through your nose if you can. I know you're stuffy. So there's our little floss in place. And now for 1 minute, we're gonna put the little SDF in there. Gonna soak it up into the floss. Take a big breath. Almost done. And you'll get, what was that special eraser that she got? The number 7?
Number 7.
Good girl, you're doing great.
You know who's awesome at puzzles? Emma.
Really?
You good at puzzles?
I love puzzles. What's, like, how many piece puzzles does she do?
I think the biggest we've done is like a 50 or 100 one, right?
Nice. Maybe they'll have good puzzles at Toys R Us.
Yeah.
She is earning it. So I got this all soaked up into the floss and the timer's counting down. And once that goes off, we'll just cover it with your varnish and you'll be done. Look at that.
Seconds.
Mhm.
Awesome job, babes.
Can you pass me the varnish? Thank you. You're doing amazing, Emma. Okay. Good girl. Almost done. 5 seconds. 4, 3, 2, 1. Take off. It was a long 5 seconds. Okay, we're gonna take that out and cover it with varnish. And voila, you're done. Take this out. Perfect. And we'll rinse out your mouth, get all the cotton out of there. Ready, honey? We're gonna put some Vaseline on you. It's like lip gloss. You're so good. You are the best, huh? So this is just to prevent any staining on her face, because if the silver gets on there, it will leave like a temporary tattoo. But it'll come off within a couple of days, week, just depending on her, how fast her skin cells turn over. You are so good. Can I see your cute little teeth? I'm gonna, yeah. You're the best. So let's see. There they are. Okay, we're gonna dry them off. Can you open big? It's almost like they're stained with whatever candy or something that she had. Are you good? Can I have the air, please? Yep. I'm gonna dry your teeth. Sure. Thank you. Okay, ready? I have air. Tickle, tickle. Okay. A little air. Good girl. You're doing so good. Can you pass me the little micro brush? Thank you. Okay, stay open really big. Good job. Oh, you're the best. Good girl. So yeah, see how I have her lip up? When you're brushing her teeth at night, just look up there and look for any pimples or inflammation that would indicate an abscess, because these two are pretty severe, but we might be able to get them to remineralize it. It's worth a try. And then in 2 to 4 weeks, come back and we'll do this again, and I can put a material over these holes called glass ionomer. It'll help mask some of the dark color, and then it'll also help her tooth to heal. And hopefully we can save these front teeth. But you'll be adorable regardless. Did you start the timer just for 1 minute? I'm gonna do 1 minute. See how it's starting to turn color already? So once it gets exposed to light, it'll really color. Oh, you're so sweet. The best little baby. Is she always this good?
She's kind of, she likes to brush her teeth, just likes candy too much.
She does like candy. Who doesn't, right? I like candy too. Good girl. So we're just gonna wait 1 minute, and then I'm gonna put some yummy, yummy vitamins on your teeth, and then you're gonna be all done. Good girl. Can you pass me the varnish? Please. About 20 more seconds. Doing good. So this is her fluoride treatment. I'm just gonna paint it over her teeth when we're done here. Let me do your other teeth first. Oh, it's been a minute. You have been amazing. Can I get some more of the varnish, please? Thank you. You are the best. Can you open really big? You're so good. I'm going to cover those up. So you can actually skip brushing her teeth tonight because the varnish will still. As you can see, I discovered I got some SDF on my arm from a less than cooperative patient. It happens. And I'm going to show you the best way to get it off in real time. So hydrogen peroxide is one of the great options. And you can use gauze, or let's say it's the parent calling because they discover later it's on the kid's face. They could use like a makeup remover, swab, whatever they have, a paper towel, a tissue. So hydrogen peroxide, and then just start. Oh, that's very good. Nice, see, comes right off. If it gets in your fingers, like anywhere there's dry skin, it's more tenacious, or like if it's on their lip, you can mix water and salt, and it makes a little slurry, kind of like sugar scrub, and it'll lift it off of thick, dry skin. That actually came off nicely because it wasn't on thick, dry skin. All right, ta-da! Is your SDF expired? Well, let's find out. This was inspired by a recent post I saw where someone had a new bottle of SDF Advantage Arrest from Elevate Oral Care, and they were concerned because the color looked very light or very pale. So what I shared with them is as it gets older, it gets darker in color and can indicate that it's close to expiring, or it may in fact be expired. So let's take a look at that. So if you take a peek at the drops that I placed here, I put 2 drops just so you could see the color better. So obviously if it was a single drop, it'd be even lighter, but notice on the left, this drop of Advantage Arrest is quite dark blue. If you look really closely, you can even see some little black flecks in the solution. Well, that's a pretty good indicator that this is old and perhaps expired. And sure enough, when you check the bottle, or the box in this case, I'll show you, it did in fact expire October of 2022. All right, so just keep an eye on the color. It's great that they put the color because then it helps you see where you place it on the teeth, or like, let's say you have it on floss, you can see it more easily when it's tinted blue versus when it's clear. Now this is a 8 milliliter bottle. So we go through it a little more slowly. This was in a new patient room, so definitely going through it less frequently there. So now we actually have the mini bottles, which are only 3 ml, and you get them in a box of 3. But anyhow, so in the areas in our clinic where they get used less frequently, it's nice to have the smaller bottle, so that way there's not a higher volume that might get a chance to expire before you're able to use it all. But this pale blue, that's the new bottle. And sure enough, if you take a look at this, this expires October of 2024. So yes, if you get some new SDF, it might look light blue. It doesn't mean it's not as effective. It's just brand new. If it's looking dark, check your expiration date. It might be time to order a new bottle. Hope that helps.
All right, so that's the last of her videos. This is one of mine, and in it, there's a girl called Sarah who I met, and I went to the States following this, and I think SDF is obviously very good for children. It's also really good for the elderly, and they're more prone to cervical caries. And what's happened, there are lots of pictures of cervical caries showing, you know, when the tooth goes dark. But what's interesting is what Sarah says, so hopefully you'll hear the sound on this one. The videos on treating tooth decay, the audios treating gum disease in care homes.
So we applied the SDF, and probably a year in, I kept saying, oh my goodness, the plaque is not sticking anymore. Their gums aren't bleeding as much. And it was very interesting to hear Haley say that it does not allow the biofilm to adhere, because I've been saying this for a few years now, and it's just one of those things that there isn't enough research.
There's plenty of research on how we can help children. The problem is, it's just too cheap, and it can be applied by nurses who are trained. We just need to promote it more. And as for the periodontal disease, well, that's a different thing altogether.
So like Sarah said earlier, she applies it to herself, and weighing the pros and cons of the darkness versus letting the cavity grow. You know, I've applied it to myself a billion times.
Well, I don't think it's quite a billion, but it's a lot. And I think that's a way that people can learn really quickly and easily. What was surprising from the children's videos is that none of them complained about the taste, which I thought would be a bigger issue. And yeah, so let's see what I've written here. So the objection about the colour, right? So yeah, it does go dark. Well, I don't think young children are really that bothered. I mean, they're a little bit bothered at the front, and as you know, you can cover it with a white glass ionomer, but it's far better than the space, and certainly the same with the elderly. So where people describe it as a problem, I think it's a benefit. And I always remember a friend of mine who, after he had a baby tooth out, thought he'd clean his teeth even more. Well, you know, he'd never get another tooth taken out. Well, the idea would be the child should never want a dark tooth. You know, it's all about how you frame the issue. Is it a problem or is it a benefit? The famous one was Viagra, when they were going to give it up because it wasn't having the effect for heart disease. But as you know, it had quite a useful side effect for certain members of the population. Anyway, so this is a project I think that would be very good in care homes for the same reason. It's just to, it would disguise the taste if it's actually applied there. But also, this is just a good project where you want to stimulate saliva flow, but you don't want to have sugar. So, we need to think outside the box. And yeah, I just thought that, topical anaesthetic, nobody liked the taste of that. But I used to give a lot to the children, give them the bubble gum, but some really liked the pina colada. And then for a while, I think they stopped doing it. But yeah, so you can actually mask these things. And then I think the other one I was worried about was this. We were taught that if you took out one tooth, you had to take out a balancing tooth on the other side, and then you needed compensating extractions. And I always thought this was weird in that, had the crown already started to form, and was there really any space closure? And really, we don't want to make dental phobics. The whole idea of SDF is they never have to give a child a filling. I mean, I very rarely, used anaesthetic. I never referred any child for a general anaesthetic. And it's difficult. The first time they had anaesthetic is when I was taking teeth out for orthodontic reasons. It wasn't that brutal. I think there's a lot we can learn from each other. And this barrier here, well, as it says there, the Health Education England are promoting these courses, and they take 14 months. And there are only 7 in the UK. I think it may have gone up slightly. But hardly anybody goes, partly because the dentist won't release them, and partly because you have to travel so far for most people. And, you don't have to do this. We could do it you can more or less do it online with some learning on video evidence, just like you saw there. Where all should make the videos, you can practice on one another, and just don't get any on your skin. But if you do, you know how to get rid of it. But this is wrong, really. We should not need to do a 14-month course in order to apply fluoride varnish. Because, you can take blood. You can learn how to take blood in a day, right? Now, given the choice, would you prefer a little bit more learning for taking blood than actually applying a paste on a tooth? So we've got to think about how we're going to educate people to deliver a care service. And they do it in the States. So if you have a look at this website, this is what people are doing. And so it's actually, I think it's Sarah's company. And we should have these people over in the UK teaching us their experience. We don't have to do the research again. They're only following on from what was done in Japan for 70 years. This product we can actually provide on license in the UK. Well, it should be available for children, and there should be a fee for it. But if there isn't, I'm sure a parent would rather pay if they could afford it. But we need to think slightly different. And we ought to get Sarah to come over and tell us of her experience. Or Jeanette McLean, of course. I'll have to email her to see if she comes and gives courses. And this is Fiona, who I met when I went to Portland in the States. And she's a hygienist in Scotland, a mobile hygienist, and we're hoping to set up a course for hygienists and therapists on how to set up your own business and deliver this kind of care, plus quite a few more. And I've contacted the GDC asking, what they need, what a dental nurse needs to do. Well, you don't need to do the course. That's the weird thing. Is you don't get a qualification for going on the health education course as such, and it kind of says it there, and it's slightly ambiguous in that you have to do it on prescription. Well, does the dentist have to be there or not? Can we use the new devices that say if it's caries there or not? Or can we just say that the SDF is like a caries diagnostic tool? There are caries diagnosis medicaments that I never bought them, but you could use them. But SDF's the best, isn't it? Because it actually stains it. I think if it's in someone, your average adult, then as it says there, you can cover it, or at least you can delay the treatment that is more conventional and more aesthetic. So what it says there is that you just need to find out if you're covered with your indemnity provider. And for most other things like this, one would say you have to just give informed consent. Ask the parent, would they rather just wait and let things get a lot worse so the child has to have a general anaesthetic? I'm sure there are ways around this, but it just needs the people to find out from your indemnifier. So I met Sarah when I went to Portland. I'd seen her on a video, on a webinar, and that's what really got me interested in what they were doing. And we have a shared common interest. So this is her story. So just pause it and just read it. And my story is not dissimilar. And then move on to this. And this is basically, Sarah sent me a series of videos showing how she looks after people in the care home environment. And so this is her treating Annie. And as it says there, just listen and repeat it, because the things that she describes as she's doing the treatment, or the care as you would describe it. And also, my own view was how dry Annie's mouth was. And that's what happens with the age. We need to keep their mouths moist. On the other hand, it was a lot easier to treat than treating a child. So anyway, this is the series of videos coming up. So again, just pause them as you go along. But basically, it's about 4.5 minutes of Sarah looking after Annie.
So we can see Annie has some plaque along her gum line, inner proximal, class 5, and food debris there in the buccal corridor of that vestibule. So we're just going to kind of remove everything so we have good access to apply the silver treatment. It's the soft debris we really want to get off there for her. And once again, you can see her gums bleed a little bit, but with all of this plaque, one would expect to see a lot more inflammation of the tissues. And because she is treated every 3 months with cleanings and silver diamine, there is actually a great reduction in the tissue inflammation, which is amazing to see from what it was when we first saw Annie. So now we're brushing the upper teeth here, just getting that cervical and interproximal plaque and food debris off so we have a clean surface to do the silver treatment. And you can see all the areas where that food debris was sitting are areas that previously have been treated with silver diamine. And once again, little bleeding, not too bad. So here on the lower left, we can see how dark these teeth are back here. This area just really traps food. And it just kind of sits in her teeth unless a staff member can help her brush and get that food debris out every day. So it has been very beneficial, but you can see how the tooth had a lot of incipient and demin, that it's protected it from making a cavitated lesion over time, as well as the gum health. So you can see here on the top, it's mostly this parotid gland I don't want the saliva to get to. So I'm just kind of going to isolate with gauze up there. And then I am drying. I dried all those teeth on the cervicals. One thing I want to mention is we do have informed consent from the POA guardian to apply silver diamine, and the patient has also consented to it. We always get that consent because of the concern of the discoloration. We also always tell patients and families that a tooth-colored filling can be placed on top, a GIC for example, if the area is large enough that it's trapping food, or if the patient is concerned about aesthetics. You can see the gum tissue will turn a little bit white. It can blanch it. It will go away within a few days. The teeth stay dark where there is an active lesion or incipient lesion. A healthy tooth surface does not change colors. Once again, isolating the parotid gland, keeping that saliva out. Just coming here and getting as many buccolingual tooth surface areas. I'm not concerned about it turning areas dark where there's no lesion. I'm more concerned about the health of the tissues in those areas, and that is why I'm doing it on areas that have lesions as well as inflammation and no lesion.
You can see how fast this is to do a silver treatment though. This patient's whole mouth has been treated within a couple minutes.
Okay, Miss Annie, we are all done with our treatment of silver diamine fluoride and fluoride varnish. Can you tell us how that was?
Fine.
Was it easy? Was it difficult for you?
No.
It was easy?
Yes.
Okay. And any bad taste, or did we mask it with the fluoride? I think we used caramel. Could you taste the bitter silver?
No.
Okay, so using the gauze and everything isolated it, you didn't taste too much. Okay. And you know nothing to eat or drink for a little while here, about an hour to 2 hours.
Yeah, that's good because I won't eat till noon.
You won't eat till noon.
Yeah.
Okay, Annie. Well, we will see you again in 3 months. Thank you so much.
All right.
And this isn't new. I thought about this a while ago, is that the other things I'm interested in is the 3D printing. And this, I think I made this about 4 years ago, where I thought we could use bleaching trays, where if someone has a lesion, then you could apply the silver diamine fluoride in a reservoir, and you just have to mark it on the night guard, where on the bleaching tray, and that's how we could do these kind of things. And also now you think, well, actually it could work really well for periodontitis and for implants. There's no research been done in it. The first bit of research was in 2001 for silver nitrate, I think. Very little since then. There was an article that's just come out, if you go into Cochrane 2024, saying it's got positive outcomes. Needs more research, which it always is with Cochrane. But why hasn't it been done? My own view is it's too cheap. So I hope you found this reasonably useful and thought-provoking, because this is what I'm trying to do. And yeah, if you're I hope you're interested, but register on the site and you'll be able to promote these services. So if you learn the 3D printing, teledentistry, do this, then you'll be able to promote your services online for the public, and ideally not just a website, but on a dental app. So there's a blog page there. If you go into the blog page and look up, I think I put it on there, the advantages of an app over a website. I will do that. And hopefully over the next few months and years we can develop a dental health service that helps us provide therapy for everybody one way or another, because we can't just keep training more dentists, because the current business that we have at the moment is just basically treating what people want, which is high-end dentistry. But yeah, if you look on Dental Portal, you'll get all my views there on the GDC and how we need to change things. Anyway, that's more than 20 minutes, so I'll put something in the text saying split it into 3 or something like that. Right, bye.